There's no question that raising an adolescent child is an incredible feat. From the emotional, social, and academic stressors, there is a lot involved with the changes during adolescence. And most importantly, that emotional roller coaster that we call puberty. I'm here to let you know that as parents, you're not alone. Everyone is going through it together. And I'm going to give you the best advice I can and some guidance on how to raise your adolescent child and how to go through that crazy roller coaster that we call puberty on the next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we have you patients ask your questions so that I can answer them in real time. Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics. And today I'm going to talk to you a little bit about pubertal development, hormonal changes, and just raising an adolescent in general. I'm here to answer any questions that you might have and to help guide you through this process. Please send in your questions. It looks like we have a question coming in now from our Facebook page. This question is from Crystal. Hi, Dr. Constant. Our little baby Jasmine isn't a baby anymore. She's 12, and her body is definitely changing, but what's not cool is the emotional roller coaster she's taking us on. What can we do to help her adjust to all these hormonal changes? Well, Crystal, that's a great question. And I think the first thing to do is really talk to your daughter, Jasmine, about what is happening. Sometimes we might tell them that they're being emotional, of which alludes to the fact that they might be behaving in an irrational manner. And that's not really fair to your child to feel that they're being irrational and maybe uncontrollable. Rather, we should talk to them about the feelings that they're feeling. We should explain that we've had those feelings before as well, and then just talk through the changes that happen during puberty so that she knows what to expect. So for example, you can tell her, sometimes it's normal to feel a little sad and not have a reason to feel sad. And that sadness will go away, but then you might feel a little more angry or irritable, just a range of emotions that you typically feel when you're going through these changes, and explain to her that they will happen or they are happening so that she knows what to expect and she doesn't feel abnormal or isolated. And then you walk her through them and talk about why these things are happening and how normally, as the process goes on, they will resolve. And so I think that's a really good way to communicate with her so that she doesn't feel scared either. It's one thing to have these emotions and feel like your parents don't understand you, but to also feel scared because you don't know why you're acting the way you are. So I think that it's really great if you can explain the process to her, or even bring her to her pediatrician and have a talk together about what to expect, what to look for, what is normal, and most importantly, what is abnormal during this process. Good luck. We have another question coming in now from our All Health TV app. This question is from Sophia. Dr. Constant, I have 2 teenage boys who, like many kids their age, aren't eating as healthy as they should. I buy healthy snacks and I make healthy meals, but they still manage to eat a lot of fast food and processed foods. How can parents encourage their teens to make healthier food choices without feeling like they're forcing them? That's a great question. And everybody is really dealing with this problem because it's so hard. You want your kids to eat well and to almost be perfect. But the reality is all of us slip up and we have junk food or sweets, and some of us have our vices, and that's normal. And you don't want a child to feel so restricted where they should always eat exactly what is expected of them and never fall out of line. That's just unrealistic. If you're making healthy meals, you're buying healthy snacks, you're promoting a healthy environment in your home, then you're doing a great job. You're already ahead of the game. Your kids understand they have the foundation and they have the knowledge to make the right choices. They're not always going to make the right choices because they're kids, and we need to understand that and be forgiving. I'm not saying to encourage fast food or processed foods, but I'm saying to understand that sometimes when the temptation is there, they may perhaps give in and go ahead and make the wrong choice. But you're doing a great job by already creating this wonderful environment and encouraging them, and I commend you for that. Looks like we have another question coming in from Facebook now. This is from Taylor. Hello, doctor. I'm a widower raising my wonderful teenage daughter, Serafina, on my own. We have a great rapport, but she's just started dealing with both physical and emotional hormonal changes, and I'm not sure how to talk to her about everything that's happening. I'd love some advice. Well, that's a great question, Taylor. I think, again, it's kind of going back to Crystal's question, I think the most important thing is to discuss exactly what is happening to your daughter. And I think that unfortunately in a lot of schools, they're no longer discussing human growth and development and a lot of the changes that occur in the human body. So now it's up to you to talk about this at home, really from a biological perspective. You want to explain to her why her body is changing, because there's a physiologic reason for the body changes. You want to explain to her that her body is changing in such a way to actually prepare to carry a baby, whether she wants to or not. This is the natural process. You want to explain why maybe her breasts are changing and her hips are changing size and her body looks different than it did before. There are scientific reasons for all of these changes. And it's only fair that you discuss them with your daughter at length so that she understands why these things are happening. As far as the emotional changes, not everybody goes through them, but they are there. And again, you can tell her as her mother that you also went through that and you understand and you can empathize with her because you remember what it felt like. And that way she doesn't feel so isolated or quote unquote like she's crazy or out of control. So you can talk to her about that and also explain that this is part of frontal lobe development, but she's still very young and her brain is not fully developed, despite what she may think, and that in the process of developing, you are going through some emotional changes, whether it's sadness or irritability or anger. You just want her to understand that these things are normal. Good luck to you. All right, if you want to send in your questions, please take a look at this promo and send in your questions before the show ends.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So it looks like we have a question from our YouTube app. This is Sal. Hey, Dr. Constant. Unfortunately, I didn't have a great relationship with my old man growing up. Now I've got a boy of my own and he's getting super moody. How do puberty and hormonal changes contribute to mood swings in teens? What can I do to help us communicate better? Well, Sal, I'm really sorry to hear that. And the mood changes can be very difficult. And I will say that, well, first of all, yes, there is an increase in testosterone. The boys get a little more angry, not angry, but they just get a little bit more aggressive than you're used to seeing like when they were little boys. As a father, as a male, you are another male figure. It's two men now living in a home, almost challenging each other a bit. So I, suggest that you take the higher road with your son. You are older, you understand, you know what's going on with him. So you should try to disengage or back down when he is challenging you. Some parents feel that the challenge and the behavior is crossing the line and oppositional, being defiant. And I don't think it's fair to really judge them as being defiant. I think first and foremost, before you start reprimanding or fighting, just take a step back and say, you know what? They're kind of out of character right now. They're going through something. Let's disengage. Let's diffuse the situation. Let him calm down. And then later, in another moment, completely removed from the incident, you then talk to him man to man, and you explain to him what he did or did not do correctly, or why his outburst or whichever behavior was inappropriate and unacceptable to you, because of course you still have to set your boundaries. You can explain why and how to have handled it differently. You went through it as well, so now you can guide him. You can explain to him, listen, I know that you felt this way, but next time we can handle it this way. And that way, in a clear, coherent conversation, you guys can communicate and explain not only your boundaries that you have, but your expectations for him. And he can explain to you what he's feeling and what he feels his expectations are. So I think it's very important to try to communicate in a calm way, because you already have one teenager that's kind of a little bit erratic, let's say, and quote unquote emotional, and just to mix that with an angry parent that's going to discipline and reprimand and get angry and puff their chest out and try to go head to head, it just doesn't work. It will never work. It will never resolve. You'll just keep on fighting. So my suggestion to you is to take a step back, walk away, pause at that moment, and let them throw their fit, and then circle back and discuss it later. I think that's the best way to handle it, especially when it's, you know, man to man or female to female, because I think there's a little bit of a challenge there where the two are going head to head, and that never really works. Good luck, Sal. Okay, it looks like we have another question coming in from the All Health TV app. This question is from Daisy. Hi, Dr. Constant. My 12-year-old daughter, Ivy, spends a lot of time on social media, and now she's saying she wishes she had nicer clothes, a smaller nose, and a better body. She's only 12. Social media can have a devastating impact on an adolescent's mental health. So how can we as parents help our teens navigate it? Well, Daisy, I will say the first thing I think as parents, all of us should do is not allow our children on social media. I know that it sounds unrealistic or difficult, and I know that a lot of us don't want our children to feel left out, and we want our children to be part of the group, and if everybody else in class is doing it, you want to let your child do it. But we've discussed this over and over, and I think everybody agrees that there's nothing positive that comes out from young children being on social media. There are only negative effects. They're not learning anything. They're not improving their mood. They're not improving anything in their life. They're not gaining anything from it. All they're doing is comparing themselves to others. They don't even understand what they're seeing and how to differentiate reality from falsehood. Most importantly, we live in an age now where AI is on the rise. And our children don't even understand that most of the things that they see on social media or on TV or, you know, online are not even real. You know, now you don't even know if you're looking at a real photo of someone or a digitized AI photo. So much has been manipulated, and these young minds are not equipped to A, decipher, or B, even interpret any of the information that they're receiving, which is why it has such a negative effect on their mental health. They are incapable, they are immature and incapable of interpreting this in the correct manner. So I say, take your child off of social media. And while they're off of social media, you will use that time to educate them and give them the tools they need to understand how to handle what they will be exposed to in the future. They need to understand editing and AI and filters and, you know, people only showing what the good side and what they want to see. They need to understand all of that before they're engaging in social media. So that is my advice to you, as I'm trying to keep young children away from that as long as possible until they are emotionally and mentally equipped to be exposed to that. Okay, these questions keep coming in. I think everybody's in the same boat and they really just need some help and guidance with their kids. Looks like we have a question now coming in from YouTube. This is from Augie. Hi, Dr. Constant. I came in on the tail end of a news story a few weeks ago about teenagers not getting enough sleep these days. As the father of 2 teen boys, I'm curious why sleep is so crucial during adolescence, and how much do teens actually need? Well, teens need 8 to 10 hours of sleep a night, believe it or not. It is very important for many reasons. Number one, growth hormone is secreted from the brain during sleep. So this is when you're getting your best growth in. And everybody complains about their height and they want to be tall, they want to have this, they want to have that. You need to get sleep. You need sleep for these things to happen. Good sleep, not interrupted, disturbed sleep and taking naps here and there and putting your head down at your desk at school. You need a full 8 hours of sleep minimum. This is when the neurons in your brain actually regenerate, they repair themselves from damage, they actually are firing and solidifying information that was learned that day, forming memories. Everything that you are taking in during the day is finally absorbed and molded and solidified in your brain when you are sleeping. So it is incredibly important for children and adolescents to get adequate sleep for their physical health, for their mental health, and for their academic well-being. Guys, these questions are great, and I just want to let you know that I think it's important that parents understand that what they're going through at home with their adolescent, while it might be unique, it is not unheard of. And I think that a lot of parents are scared to talk about it with their friends or with other classmates because they think that their child's situation is very unique and it's something that no one else is going through. Every child is having issues with self-esteem, or they might feel left out at school. The most popular girl at school comes home and tells her parents that she feels she doesn't have friends, and those friends are going home and telling their parents that they feel that this person's not friends with them. I mean, there's such a different perception between each child as to what is really going on, that it would be so helpful if we came together as a community, meaning the parents of these friends, if you talk to each other about what's going on and just share your stories so that you understand that your child isn't alone and everybody's feeling usually about the same thing. You feel either left out, you feel like you're not as cool as everybody else, you don't look like what anybody else looks like. Some people think, well, my parents are the only ones that do this, and everybody agrees, no, our parents do it too. I mean, you can just talk to each other and you'll feel that sense of community and maybe feel a little bit better about what's happening with your teen. It's not something unheard of. We've all gone through it ourselves. So just to keep that in mind when you're really stressed out about your adolescent behavior. Oh, it looks like we have another question coming in from Facebook. Audra and Damon. Hi, Dr. Constant. Our darling daughter, Matilda, just turned 13, which we guess officially makes her a teen. She's a very bright girl with a good head on her shoulders, but we're a little concerned about the intensity of peer pressure these days. When and how should we begin talking to her about drugs, alcohol, and sex? Ooh, that's a very good question. So I think the first part of this question I would say is that you really need to gauge your daughter's emotional maturity. There are some 13-year-olds that have already heard things or are inquisitive and they want to know, and there are others that are very young 13-year-olds that really just don't even have any idea about what you're talking about. So you don't need to jump in so quickly. You really need to kind of see the type of circle that your daughter's in, who she's hanging out with, and what she's exposed to. I also feel that it's very important to find out what they know first or what they think they know, because you want to debunk any myths or incorrect information. These kids all talk. They talk to each other, and some of them are a little more informative than others, and they make it seem like they know exactly what they're talking about, and then they teach all their friends, and then you find out what your child has heard or learned and what they think is reality, and it's just so wrong. So I think the first thing to do is find out what she knows or what she thinks she knows and what she's heard. And then you can go from there, and you can kind of clarify or explain or elaborate, and then just see what she really wants to know and what she's interested in. I think it is important to always discuss drugs and alcohol just in general, that it is something that is around and that she'll be exposed to. I don't know how much of it you'd like to discuss, but I think it's important for them to understand that they will be exposed to it. They will be offered at some point during their school years, and just talk to them about how important it is to stay safe and what can happen if they are drunk, or just kind of the consequences of being taken advantage of and things like that. So I think it is important to talk about, but the level of detail is going to depend on the emotional maturity of your child and also just kind of the social setting that they're in. You also don't want to say too much and then your child is the one educating everybody else, and so that gets a little sticky. So I would say just kind of stay as superficial as needed until you see that your daughter has a couple more questions, or maybe some misconceptions that need to be cleared up. Okay, well, in case you forgot or you don't know how to send in your questions, take a look here.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So we have another question coming in now, and it looks like it's on our Facebook page. And this question is from Pilar. Hola, Dr. Constant. I've recently noticed that my son Miguel has been eating more than normal. Truth be told, it's beginning to look a little like binge eating to me. What are some red flags for eating disorders in adolescence, and how can they be addressed early? That's a great question, Pilar. Well, so some of the red flags for disordered eating, and I like to call it disordered eating because eating disorder is actually an ICD-10 code, a DSM-4 code in medicine, and that's a psychiatric disorder. A lot of adolescents suffer from disordered eating, which is maybe not necessarily an eating disorder per se, but a lot of bad habits, carb cutting, calorie counting, that isn't so much where they would need psychiatric intervention, but they're just creating a lot of bad habits and going down that road to possibly leading to eating disorder. So some of the red flags, I would say a lot of calorie counting, reading the backs of labels, being too preoccupied with how many calories are in a meal, and also preoccupied with their weight. I think once your child is able to tell you they have a target weight, that's a little more concerning. Wanting to look better, feel better is one thing, but having a number that you have a goal to attain is a red flag. So, just a number that they want to drop to. I think also skipping meals, of course, is a very big red flag. Anytime your child is skipping a meal, we need to start having the discussion right away about disordered eating and maybe body dysmorphism. And also just when your child doesn't want to eat with you as a family. So a child that pulls away from the table, that wants to eat alone, that ate before and says they'll eat a little bit later, those are also red flags. So those are things to look out for when there's just like odd behavior around eating, around meal times, and of course around weight and it could be low weight or high weight. Some want to gain weight, they want to bulk. So a lot of preoccupation with a body image is also a red flag that you really want to make sure you keep an eye out for. Okay, so it looks like we have another question, and it's coming in from the YouTube app, and that's from Brad. Dr. Constant, are there specific signs that a teen's growth and physical development may not be on track? Absolutely, Brad, that's a great question. So every time you bring your child to the pediatrician, from birth until actually 18 or 19 years of age, we plot their weight on a growth curve. And the growth curve is very important because it tells us as physicians if their growth is on track, their weight and their height, if they're on track for their age, for their body type, and for their gender. And so we can see some red flags on the growth curve if, for example, the slope is going down on the growth curve, meaning we're losing weight. If it's plateauing, meaning your child is not gaining weight adequately or appropriately. If they are not gaining weight fast enough, because we look at the rate of change, so it can go down, it can go up, it can be flat or have a very slow rate of change. So those are all things that we look at. In addition to the height, we check the height curve as well, and to make sure the height is on the right rate. And then so with that, we can tell if there are some disruptions, maybe nutritional deficiencies, maybe pubertal development is not occurring, whether it's delayed or sped up. There are a lot of things that we check with that growth curve. In addition, at the visit, which I've discussed before, and I think it's a great time to mention again, this is why as physicians during the well child checkup, we ask that the patients, male and female, take off their clothes and wear a gown so that we can examine their body. We need to examine them for the Tanner stages, which is the stages of pubertal development. We check underneath the arms, we check for breast development, we check for pubic hair and testicular development. And that is very important because that tells us as physicians where your child is on the track of puberty. There are 5 Tanner stages, and we actually rate those stages so that we know if your child is on track or if they're delayed, or if they're too advanced, at which point we can actually even intervene. So there is a lot that we learn from a growth curve and from just looking at the physical development of your child. So I know that sometimes the kids are very uncomfortable, or they may ask that they are not examined underneath the clothes. And I understand that, and we want to respect their decision and their comfort level, but remember, or maybe even try to talk to your kids about it before the visit. It is very important, and it is for medical information, and it is something that we need in order to keep track of their development. So I just want to kind of recap for everybody, because I know that we discussed a lot. I think number one, please speak to your children about the scientific changes that are going on in their body. Explain to them that hormones are actually surging for a reason. Your brain is developing, your frontal lobe is developing, your body is changing to prepare to become a man, or a full-grown man or a woman. Females, your body is changing so that you can prepare to actually carry a baby. These things are normal to discuss with your children. They should know what is happening to them. Speak to your child about understanding what they're feeling and what they're going through. You went through it. They know you did. You were once young, you were once an adolescent, and now you're an adult. Talk to them about those changes, empathize with them. And most importantly, when you reach a boiling point, please, as parents, try to disengage. Pull back, let your child have their fit, and later circle back and talk about it in a calm and reasonable manner. I'll let you know this. Everybody tells me at age 12, a little bitty alien comes into your home and snatches your child and replaces it with an adolescent. So we're all going through it. I hope that it's an easy road for you and not too rough, and I hope that these tips really helped. See you next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.